Cervical intraepithelial neoplasia, or CIN, sounds complicated, but it is important to understand. CIN refers to abnormal cell changes on the cervix. The cervix is the lower part of the uterus. It connects to the vagina. CIN is not cancer. However, it can lead to cancer if left untreated. The good news is that CIN is often preventable. It is treatable, especially when detected early. CIN is grouped into 3 grades. These are CIN1, CIN2, and CIN3. CIN1 represents mild changes. CIN3 indicates more serious changes. Remember, CIN is not a death sentence. With awareness, regular screenings, and timely treatment, women can effectively manage CIN and maintain good cervical health. CIN often has no noticeable symptoms, especially in its early stages. This is why regular cervical screening is crucial. It can detect abnormalities even before symptoms appear. However, some women with CIN may experience abnormal vaginal bleeding. This includes bleeding between periods, after sex, or after menopause. Unusual vaginal discharge might be watery, bloody, or have a foul smell. Pain during intercourse is another symptom. If you experience any of these symptoms, consult your doctor immediately. They can determine the cause and recommend appropriate tests. Remember, these symptoms could also indicate other conditions. It is essential to seek professional medical advice for accurate diagnosis and treatment. Diagnosing CIN typically involves a combination of tests. These help healthcare professionals evaluate the health of your cervix. A pap smear is a routine screening test. It collects cells from the cervix. These cells are examined under a microscope for abnormalities. If your pap smear shows abnormal cells, your doctor may recommend a colposcopy. This procedure allows a closer look at the cervix using a special magnifying device. During a colposcopy, your doctor may take a small tissue sample or biopsy. This sample is sent to a laboratory for microscopic examination. The results of these tests help determine the presence and grade of CIN. This information guides decisions about further management and treatment. Managing CIN depends on several factors. This includes the grade of CIN, your age, overall health, and desire for future pregnancies. Treatment options may include watchful waiting. For low-grade CIN, especially in younger women, close monitoring may be recommended. This involves regular pap smears to observe any changes. Another option is the loop electrosurgical excision procedure, or LEEP. This procedure uses a thin, heated loop to remove abnormal cells from the cervix. Cold knife cone biopsy is another procedure. It removes a cone-shaped piece of tissue from the cervix using a scalpel. It is important to discuss all available options with your healthcare provider. They can help you make informed decisions about the best course of action for your specific situation. Early detection and prompt treatment of CIN significantly reduce the risk of cervical cancer. Regular cervical screening is the most effective way to protect your health.